Italy coronavirus death toll soars by 133 in a day. While in Germany there's loads of infected people but nobody died yet. I don't get it. I live in Scori, province of Latina, Lazio, about 2 hours from Rome. We had 2 reported cases in our area, a lady coming from Cremona. I am here working. I can't go back to the Netherlands until the end of the month. All the schools and higher education institutions are closed, and I haven't seen Rome this empty for a long time. Trains are still working within the region and the only queue is at the pharmacy. Edit, Q. Here in Italy tradition are you kiss on both cheeks when you encounter someone you know on the street. Now we bump shoes, and drink a bit more wine for the heart's sake. My dad is 80 years old, with a lot of underlying health conditions. The fact that a case was confirmed in my country and there are others under suspicion doesn't do shit to ease my mind. Correct. It should be mentioned that all but 2 of the new deaths in Italy were 60 or older, and most had underlying health conditions. https://twitter.com/bnodesk/status/1236706833278132224. Still, though, very, very scary. Did 133 die in one day, or were the statistics not updated for a while? Does anyone know why this might be? Is it purely because the spread has increased so much, or were they just not testing enough people so they couldn't get care? More than 50% increase in one day. Shit is ramping up real quick. As we find more infected, we will see numbers of dead increase. But we will see even more survive. Italian here. The problem, as I understand it, is that even people in good health in a significant amount of cases need intensive care to survive the virus. If it spreads too quickly, we don't have enough intensive care spots in hospital to deal with the outbreak, and therefore lead to preventable deaths. My area has been deemed a red zone. I cannot travel outside of my area, around 30 kilometers, and everything closes at 6 p.m. Also, all establishments don't allow for less than 1 meter between clients, and in most small stores you have to wait your turn outside. Some malls have a line outside too, with authorities letting in only a small amount of people at a time. Nightlife is closed, football matches with no fans, talk shows with no audience. Even the Pope is not doing mass, thinking about closing the churches too. The virus is so far only in some northern provinces, those that hold 70% of our economic output, but people in the north seeing the quarantine coming. A lot of the students that come from the south jumped on trains last minute en masse to go back home to their family, potentially helping the virus spread. Shut down the world for 2 weeks. Who's opposed? CEO of the Coalition for Epidemic Preparedness Innovations Dr. Richard Hatchett explains the long-term dangers of the COVID-19 coronavirus. https://youtube.b/dcjdpvigjays. This is what happens when the medical services start to get overwhelmed. It's the real danger in these things. Next, you start seeing people who could be helped with a robust medical system dying from secondary issues. This is not a slam at the medical system. In Italy. Meanwhile, some high school kids in my province refused to cancel their school trip to Italy and said, "We can't stop living because of the pandemic." The school and parents let the kids decide if they would go or not. Because 17-year-olds are aware of global pandemic responses, I think it's important to mention that Italy has the highest proportion of elderly people in entire Europe, so of course the death toll is huge. To add some perspective, it was expected that this year, on average 1,765 people would die per day in Italy. https://www. Macro trends. net/countries/ETA/Italy/death rate. Yesterday, COVID-19 accounted for 7% of all deaths in Italy. I was surprised to learn how much of a factor diabetes can play in contributing to death from COVID-19. I have a friend in his late 30s with diabetes and I am concerned. Welcome to the definition of exponential. I'm currently in Italy. This is like a bad dream, only it's not a dream. Fucking hell, say what you will about influenza and shit, but there 133 people who lost a significant family member or partner. My condolences to everyone who lost a loved one by any kind of disease. Shit's horrible. Firstly, my condolence. Can someone explain to me why Italy has such an insane high death? Recently I read the news about Italy closing down its schools and colleges, but I think it's due to the virus, but other country has virus too but aren't shutting down the entire country? Any TLDR from when it start closing down universities till now? The thing is, Italy has a massive population of seniors, 65 plus, and I bet you almost all of the deaths come from that age group. Lasciate ogni speranza, voi sia centrate. Can anybody explain why China has like barely any new cases? Are they containing it amazingly well or just completely fudging the numbers? I find it hard to believe a country with such a dense population has a sudden halt on new cases. Why the hell did Johns Hopkins turn off the country/region counters part of their virus tracker? https://gi send data. Maps. ArcGIS. com/apps/ops dashboard/index. HTML #/#de75947440FD4029942347B48E9ECF6. You could see the US counts at a glance, and now you have to try to add each city up one at a time. If this something the government forced on them? Why did they do this? People with underlying health issues are both young and old and contributing members of society. Only bringing this up as a coworker said to me, well, they're just leeches on society anyway. Then I told him I have an underlying health condition. By the way, I'm his boss. Also, by the way, surprise surprise, he's also a mega hat guy. Yet I don't think this is just a problem of the media. Don't be so gullible as to fall for such simple-minded trigger word tactics. This is information, so use it to make decisions and stop just falling in line with the left or the right. Whatever happened to critical thinking skills, for fuck's sake? In Italy we have a really old population. I think the average it's one of the oldest in the world, that's why we have a lots of deaths. The average is 44. 6 years old. Dwell on the beauty of life. Watch the stars, and see yourself running with them. When you arise in the morning, think of what a privilege it is to be alive, to think, to enjoy, to love. It is not death that a man should fear, but he should fear never beginning to live. Do not act as if you were going to live 10,000 years. Death hangs over you. While you live, while it is in your power, be good. What we do now echoes in eternity. More than 100 deaths have happened in Lombardia, where the intensive care beds are sold out. This means that when a young patient checks in, the doctor must choose which 90 years old has to die first, to free the bed for the young one. Crowded hospitals are the worst problem of coronavirus. For the same reason, there has also been an increase in other illnesses deaths. The doctors are too busy and cannot react in time to a stroke, for example. Why is Italy getting hot so hard by this? In Bocca al Lupo. How the hell is Germany doing so well? This really makes me think that everyone under 25 is a morbid danger to everyone over 45. I mean, for under 25-year-olds it's just the flu, bro, but they are vectors from hell to everyone who isn't under 25. If I feel like I'm getting a cold, I'm calling the CDC and 311, then self-quarantine myself. I don't want to be an irresponsible dickhead and leave many people infected because it's just the flu for me. I'm going to be fascinated by the impact of corona if it's not properly contained. This is an old person disease. We could be seeing some pretty interesting economical changes based on changing demographics. Honestly, thanks to Italy for being one of the only honest countries. TLDR, nah, stay in your BR. Why is it hitting Italy so hard? For context, let's estimate how many people die each day from regular influenza. https://www. CDC. gov/flu/about/burden/index. HTML. US deathly vary from 12,000 to 80,000 per year. US population is 330 million. Italy population is 60 million, but affected region is say half that, 30 million, about 10% of US. So 1,200 to 8,000 per year. Or 24 to 160 per week, or 3 to 23 per day, average 13. So at 133 this seems about 10 times more deadly.